Researchers believe that drinking habits during the pandemic could lead to thousands more alcohol-related deaths over the next 20 years. A study by Sheffield University suggests that while light drinkers reduced their alcohol intake, heavy drinkers consumed even more. Let's speak to Dr. Sadie Boniface now, Head of Research at the Institute of Alcohol Studies. Now that's an independent body looking at the impact of alcohol on society. Very good to have you with us. Thank you for joining us. And I know as well as this study at Sheffield University, you have also been carrying out another study, haven't you? And I just wonder, what have you found?
Yeah, that's correct. So, like the study at Sheffield, there is an increase in number of higher risk drinkers that's begun with the onset of the pandemic. We've modelled 3 scenarios, Sheffield did 5. Ours are more and less pessimistic. In our worst case scenario, which is where pandemic drinking patterns continue and they don't go back to normal, we project that by 2035 there'll be nearly 150,000 extra cases of these 9 diseases that we studied, almost 10,000 extra deaths, and an extra cost to the NHS of £1.2 billion.
Okay, so those are the best and the worst case scenarios. Did you dive deeper into differences, say, in terms of gender or age or socioeconomic backgrounds or where people lived?
Yeah, we have looked into some of those things in our report. The most interesting results and the most concerning, I would say, are around deprivation and inequality, because inequalities in alcohol harm are already bad. Poorer people are more than twice as likely to die from alcohol as people from more advantaged backgrounds. We already knew that, and our research is suggesting that those inequalities looking forwards are going to get even wider.
Did you get any sense of why more moderate drinkers drank less in the pandemic and perhaps heavier drinkers increased their alcohol consumption?
Yeah, it's a really tricky one. It's interesting because there's not a lot of prior research before the pandemic telling us about this. I think the word that was used so often was unprecedented. So we don't have a lot of earlier research to go on. I suppose some of the reasons were that alcohol is cheaper to drink at home. So with all the pubs being closed, it's quite easy to buy more and it's cheaper than what you would have thought before. And another reason was dealing with the stress of the pandemic and the lockdowns and the bereavements and all the changes that happen. So I would say drinking to cope would be up there, and that's going to increase among people who are already using alcohol more. In terms of people who reduce their drinking, however, the more moderate drinkers, I think there was also kind of a lot of narrative around people being healthy and taking up new hobbies with all this extra time that they found during the pandemic. I think that will also have fed into the inequalities angle that I was just talking about as well.
Okay, so you've set out the problems that you've uncovered. How best to tackle the situation?
Yeah, so in our report we make 5 recommendations, and they're around making alcohol less cheap, less advertised and less available, and then also around having more resources for alcohol treatment and support. So there was a new drug strategy that came out last December that promised more money for alcohol treatment and support, but what we're saying is that would be needed over and above what's already been promised, because the increase in alcohol harm that we're projecting as a result of the pandemic has not been considered in those earlier figures.
And when you're talking about increasing the cost of alcohol, what do you mean exactly? A, by how much, and B, how would it work?
So our research is about England, and we're recommending that England introduces minimum unit pricing similarly to what's already in place in Scotland and Wales. In Scotland and Wales, there's a minimum price of 50p per unit of alcohol, but some people are saying that should be a bit higher, more like 65p in the future. So we'd be recommending something more in line with that. And as well as that, it's not just about the minimum price that alcohol can be sold at, and this really only targets the very, very cheapest products. It's also about alcohol taxation as well, so it can bring in money for the government too. There's a new alcohol duty system that's set to start next year, and we would recommend that the rates in that new system are consistent across different drink types, so different drinks are all treated fairly, and that the rates go up in line with inflation automatically each year, which is important with inflation now being as high as it is.
And just briefly, Dr. Boniface, what's the evidence that by raising the price of alcohol it does actually reduce the amount that people drink?
There's lots of evidence on this. There was a big report out from the World Health Organization a couple of weeks ago on exactly this topic. So when prices go up or something, it's like supply and demand. People do drink less. However, price is only one tool in the toolbox to reduce harm from alcohol. And having a floor price on the cheapest drinks is not going to be enough to tackle this problem on its own. That's why we also recommend the other measures around availability and advertising and treatment as well.
Dr. Sadie Boniface from the Institute of Alcohol Studies. We have to leave it there, I'm afraid, but good to talk to you. Many thanks.
Thank you.